Hi, my name is Morgan Knigge, and this presentation is in favor of involuntary commitment to treatment for substance use disorders, Assembly number 3383. This bill is proposed by Republican Assemblyman Chris Brown and supported by all Democrats. Although the majority of the support for this bill seems Democratic, both parties agree that more needs to be done to attack the war on drugs in New Jersey, specifically heroin and opiate addiction. This bill is a symbol of the bipartisan support for this cause. What is the issue at hand? This policy is born out of parents and loved ones watching someone they care about die from addiction-related causes. These parents and families of loved ones need a resource that allows them to ensure the health and safety of their child struggling with addiction. The times of waiting for an addict to hit rock bottom, searching tirelessly for open beds in treatment facilities, or depending on a criminal conviction to send their loved one to a treatment facility needs to be over. The issue of heroin addiction in New Jersey is a serious problem that needs to be addressed. The amount of cheap heroin in New Jersey has created an epidemic where users continue to die from related causes. Although the amount of people receiving treatment for opiate abuse is steadily increasing, it does not match the amount of people who desperately need treatment and has little to no effect on the increase of heroin-related deaths. The graph on the left shows the increase in people getting treatment for heroin and opiate abuse in New Jersey, but the graph on the right shows that this increase in treatment has no effect on the increasing amount of people still dying from heroin-related deaths. Therefore, the issue at hand is getting more addicts into treatment before their substance use ends in death. So, how does this bill help? This bill allows family members to commit loved ones to substance abuse treatment centers. Currently, this involuntary commitment is only possible for those suffering from mental illness. There are a set of conditions that a person has to meet in order to be committed. These include dangerous to self, others, or property in the reasonably foreseeable future, unwilling to accept appropriate treatment voluntarily after it has been offered, or needing care at a facility because other services are not appropriate or available to meet the patient's treatment needs. This bill expands the current law concerning mental health screening services to provide assessments to determine which services for substance use disorders are appropriate. So, if a family member thinks that a loved one with a substance use disorder fits any one of these three criteria, they call a screener or a social worker who gives them an assessment and makes a plan for their treatment. Either they go directly to a treatment facility or they're held in legal custody until there is room for them to do so. As a personal note, I have seen this policy, strictly regarding mental illness, have very positive effects. Someone extremely close to me with a mental illness has been involuntarily committed to treatment centers on two different occasions after fitting the first two of these criteria, and it has saved her life on both occasions. It's not always pretty to have someone involuntarily committed to treatment, but in the end, it is the life of the person that really matters. So, what is the goal of this policy? This bill allows family members to get help for their loved ones whose decision making is impaired due to substance use disorder. This gives families an alternative to reporting their loved one to authorities in order to get them into a treatment facility. It mandates that the person with the substance use disorder begins treatment at a facility immediately or to be held in protective custody in the meantime, but it does not leave them with a criminal record that could potentially haunt them for the rest of their lives. This goal is viewed through a public health lens where people who need medical attention get mandatory treatment. This helps the individual and also the good of the community. Stakeholder analysis. First, treatment facilities have the highest amount of influence and impact in this situation. At first, they might be overwhelmed at the increasing amount of patients, but overall, they're in support of this bill from a public health and financial lens. They have a lot to gain financially from all these new patients, and they also have the goal of making sure people who need help get treatment. Families also have a high amount of influence and impact, and they fully support this bill from a medical lens, wanting to ensure the medical health and safety of their loved ones. Law enforcement might also have an increase in work and calls related to this bill, but overall, they're ultimately committed to keeping all members of the community safe, healthy, and alive. So they would be in favor of this bill. The policy could also cut down on illegal activities in the long run due to drug addiction and related activities. So, from a public health and a legal lens, law enforcement would support this bill. The addicts themselves would obviously be greatly impacted by this, but have medium influence in the passing of this bill. From a medical lens, they might support this bill after the fact, seeing that it got them into treatment and kept them safe at a time where their judgment was impaired, but I believe that they would strongly oppose this bill in terms of a civil rights lens. This is the group with the largest opposition because they're literally having their rights and personal autonomy taken away from them from this bill. Taxpayers would also have to have a medium amount of impact and influence because they would have to pay more for additional public services such as law enforcement and healthcare due to the increased use from this bill. This bill also might cut down on amount of people in jail related to drug arrests, which could cut down public costs. So from a financial lens, taxpayers might be against this bill, but public health lens and the safety of the community, they would support this. Lastly, screeners and social workers would fully be in support of this bill from a moral and medical lens. Being in this field of work, they believe that the patient's highest goal is safety and health, so they would believe that commitment to a treatment facility is in the person's best interest at any costs. Next, assessing the principles of effectiveness of this bill. Is this bill well known? I have yes and no because I believe that in its current form, including only mental illness, it's very well known and it's currently an expansion of funding under Governor Christie. But this is the first time I've personally ever heard of the addition of substance use disorder being added onto this bill. Is it well understood? Yes, I believe that this bill is easily understood. Congruent with social norms. Yes, New Jersey is ready to fight the heroin epidemic in any possible way. Based on policies we've talked about in this course, it's clear that New Jersey is looking to find new ways to help addicts and fight this battle. Consequences. The consequences are a bit different from other legal ones we've studied in this course, but I believe that there are many positive, significant consequences for addicts, families, and society as a whole from this bill. As I mentioned before, it gives addicts possibilities of treatment without a criminal record, and that is positive for all three of these groups. It also ensures health and safety of addicts, which gives families peace of mind. Is it likely to be enforced? It depends on the family of those in need. If they use this bill and call for help for their loved ones, then yes, it is likely to be enforced and used. And I think that that would be the case. Uniformly informed, yes. There's a mandated procedure for assessment, so all screeners and social workers have uniform training of who will be committed and who won't. So I think that this bill will be uniformly enforced. Overall, this policy is likely to succeed. New Jersey is ready to go to great lengths to get help for those addicted. There's great evidence from other bills we've discussed, over-the-counter Narcan, expungement of records for drug court graduates. Both of these point to New Jersey being ready to stop viewing drug addiction as a strictly legal matter and break down the issue further to a patient requiring medical attention. The majority of stakeholders behind this bill are greatly in favor of it, and in the end, families need support to help their children and loved ones get help and get treatment. Thank you for watching my presentation.